Good afternoon. Today we are presenting a case of a nail injury to the finger, and we'll start.
Yes.
Uh, we're talking about the hand injury.
Okay.
There's a 48-year-old female which presented to the ER, and she was using a sewing machine when the sewing needle has passed through her left index finger, ma'am. That's the case. And during the primary survey wise, on the arrival the patient, the airway was patent. There are no any gurgling sounds, no any stridor or anything, no pool secretions. And regarding the breathing, patient was having 98% saturation and 20 beats, 20 respiratory rate per minute. Bilateral chest raise was equally visible. Regarding the circulation, the blood pressure was 130/70 and the pulse was 80 beats per minute. Yeah. And then regarding about the disability, GCS was 15/15 bilaterally reactive eye, and the pain score was 7/10. Because of the pain score being 7/10, we had given an injection PCM at this stage, ma'am. And then regarding the exposure, the patient was having an non-bleeding. It was not actively bleeding, but a nail impaled into the left index finger.
Okay. So was this the patient's
Hand, yes.
Okay, this is the real patient's hand. Okay. So only thing in the primary survey we got was the pain.
Score.
Only pain was there. That was treated with analgesic. Okay, fine.
On the clear examination, the sewing needle was impaled through the distal nail pulp of the left hand index finger.
Okay.
So in case of these injuries such as this, we can discuss about the hand infections.
Okay. So it is an isolated injury. So we directly went into the management of this one. Fine.
Regarding about the hand infections.
Okay.
Types of the hand infections and their management per se.
What was done for this patient?
This patient, basically the hand infection,
this happened only a few minutes back, right?
Few minutes back. So first we had taken X-rays to evaluate whether it is involving the bone or not. After checking out the X-rays, as it wasn't involving the bone, then it was decided to give a ring block around that distal right index finger.
So ideally analgesic, before giving the paracetamol, IV paracetamol, the ideal analgesic would be a ring block. Okay.
Ring block. Oh. After giving the ring block, it was...
with what agent will you give ring block?
Lignocaine.
Lignocaine with adrenaline? Or?
No, we don't prefer giving adrenaline in especially digital nerve blockings, because as it's a end organ, end arteries.
Okay.
Ischemia can be a high risk chance.
Okay.
So after giving the ring block, then we had removed the needle and it is securely bandaged. And
do you have the X-rays of the patient?
Yes.
Okay. So this was the ring. Sure.
Like the epilateral and this like flex finger, the nail was missing the bone, ma'am.
Okay, just miss the bone. Here we can see the bone. All the ends are fine. It is going through and through, but it is not gone through the bone. Okay. So what we did for the patient, we gave an analgesics, then we took X-ray. Okay, fine.
After that, we had given the ring block and securely removed the needle through the bed, and we completely dressed it and discharged on the antibiotic coverage.
Okay. So
the risk of, in this case, because of such through and through injuries, the risk could be infections of the hand and the various types of the infections.
Okay. So when all will we give prophylactic antibiotics in injuries presenting to ER?
When source of infection.
Okay. Prophylactic antibiotics, when all will you give? So this patient you gave antibiotics. Okay. What antibiotic did you give?
Here they just prescribed ofloxacin, like the fluoroquinolones and the...
So ideally we would have given amoxiclav or augmentin. Amoxiclav. If the patient is allergic to penicillin, we can give doxycycline and metronidazole. Okay. in penicillin allergy. So these are the two drugs that can be given. Okay. So when all will you give? So you have, this is a puncture wound. Okay. If it is any other puncture or penetrating wound, will you remove the nail?
No.
Just like that.
We need to make sure that it's not going through any blood vessel or like artery, so that by releasing it, it will not bleed out.
Yes. Suppose this patient is coming with the penetrating injury in the abdomen, will you remove it?
No.
So we want to know the extent of injury. We need to take imaging based on that. So only in the OT during surgery only we will be planning to remove it. Okay. Since this patient there was no bony involvement, we removed it. Okay. So prophylactic antibiotic, when will you give? So this patient, there is a puncture wound. Okay. Puncture wounds, we will have to give antibiotics. Then when will you give?
Cut in this.
If there is a cut injury where you need primary suturing.
Clean cut.
Clean cut no need. Clean cut no need. Whenever you are suturing the wound, then you will have to give antibiotics. Then conditions where it requires surgical debridement. Surgical debridement. Okay. Because there is high chance of infection. Then any human bite. Human bite in first 72 hours we will have to give. Okay. Then if there is any animal bite. Animal bite or scratch, where if it is fully immunized animal. Animal bite or scratch, usually if it is involving the hand, or if it is involving the leg, or it is involving the extremities, or anywhere, we will have to give. And cat bite or scratch we will have to give. Then some other conditions are also there. Suppose this patient is getting an injury in an area whether there is having less blood supply. Okay, so less blood supply. The injury which is involving the bone, then injury which is involving the tendon, injury which is involving the ligament, and injury which is involving the joint. Such cases we'll have to give antibiotics. Then in immunocompromised patients like diabetes patient, CLD patient, splenic patient, then other immunocompromised conditions, and one more condition is the extremities of each. Extreme each. So in this much condition we will have to give antibiotics. Okay. So what are we talking about? Hand infection. Okay.
The various types of hand infections which we can see in the ER as of now. Like it can be a bite wound infection, like an animal bite or the human bite. In one such case would be this fight bites, the human bite condition, where the teeth will be onto the knuckle of the other person's hand. In such cases, we need to make sure that the teeth isn't trapped in any knuckle of the joint, in the joint space. We need to make sure of that. And other thing is that in the hand injuries in the bones, basically cartilages cannot be healed once injured. So prophylactically it is better to start antibiotics if there's an infection, irrespective of the fact that the cartilage or the bone isn't inflamed or ruptured as of now. And regarding the animal bites, we have to make sure that rabies prophylaxis will be started. Regarding now the rabies, how to classify the rabies prophylaxis.
So we have a patient with the animal bite.
Yes, ma'am.
What to do first? Animal bite.
First thing, any animal bite case comes, first you need to clean or wash the wound in running water for 15 minutes.
Okay, clean the wound.
Wash the exposed area up to 15 minutes. Second is classifying the wound. Identifying the wound is which category, 1, 2 or 3. One category would be that there is an intact skin and it's just grazed upon it or licked up around it. And the second category would be the minor scratches or abrasions with no bleeding on it. And the third category would be where there is an acute bleeding, like the broken skin or even the contamination of the mucous membrane, of the internal mucous membrane. These are the categories which we divide the injury as. Depending upon the category, the treatment protocol is there. Regarding in the category 1, there is no need of any prophylaxis other than washing the area with the saline water. Second category, regarding about the just abrasion, no bleed or no contamination of the mucous membrane. In that, we have to classify whether it is a previously immunized or not immunized. If it is previously immunized, regarding it, only the washing and area would be enough. And if it is not immunized, then we need to start with the vaccination of the dosage of the in IM as the 5-dose regimen in the IM. Anti-rabies vaccine. ID 4 doses of 03728, and in IM it is 0371428. Again, there they divided it as immunocompetent and immunocompromised. Even in second category, if the patient is immunocompromised, we can start with the immunoglobulins. After this category 3, now in category 3, if it is not immunized or even if it is immunocompromised, immunocompetent and immunocompromised, both places we give 5 doses of the IM. Along with that, immunoglobulin, rabies immunoglobulin should be given. That depends upon whether it's a human immunoglobulin or the equine immunoglobulin. Human immunoglobulin is 20 international units per kg, whereas equine is 40 international units per kg.
So it is like 20 units per kg in the HRIG. And how much does one ampule contain? One ampule will contain almost 300 units. So normal international units. So an adult might require 4 to 5 almost 4 to 5 ampules. Okay. Okay. Then
this is about regarding the
rabies. So we will have to consider rabies.
Yes.
Then
third, if there is any wound, like the skin contact is broken, considering TT vaccine is also advisable.
So we will have to do TT vaccine plus or minus immunoglobulin. Okay. Then fourth is antibiotic. So what are things are there? Clean, rabies immunoglobulin, TT and antibiotics. Coming to human bite. Human bite, what all things? We will have to do, we will have to cleaning, then TT and immunoglobulin according to required. Rabies is not required. Okay. Antibiotics is required. Then what else? Then we will have to send some lab investigations to see for any blood-borne virus infection. Blood-borne virus infection. Okay. Virus infection. Okay. Any transmittable diseases. Okay.
Next hand infection would be the cellulitis. This cellulitis usually happens when there is the breach of the cut in the skin. This normal infection below this dermis.
One more thing I want to ask: will you suture this wound? Will you suture an animal bite wound?
No, you should not suture. Immediately, we don't plan for suturing. We just, if the wound is deep, then we need to put at the site. Rabies immunoglobulin is advised to half dose at the site of it and other half dose every IM.
Okay. So when all will you not suture the wounds? Any conditions where, suppose we are getting a wound, a lacerated wound, when all will you wait for a delayed healing? So this one we have told. So delayed. Not suturing. We are not planning to suture. Not suture. Okay. One is a bite, mostly more than 24 hours. Okay. Then it is crush injuries. Crush injuries. Then deep puncture wound. So this patient, if suppose this patient had some laceration and all, we will not be suturing that. Then contaminated wounds. Okay. Then bite itself, like bite by animal involving the hand, the foot, the extremities. we will be avoiding suturing. Other places we can suture actually. Okay, so this much area, this much contaminated wounds, we will. These are there are chance of contamination. If there is lot of foreign body inside, which we cannot clean, then this condition we will not be suturing. Okay. Okay.
Next condition is the cellulitis, in which if there is a break or cut in the skin, then we can suspect this kind of infection. And in this condition also, it is that main treatment choice would be the antibiotics. And if there is any collection of the like abscess, and then we need to consider surgical drainage also as the treatment thing. But if when there is a cellulitis, this kind of thing, we need to consider another differentials as deeper infections. Deeper infections like the fasciitis or tenosynovitis or the osteomyelitis or the septic joints kind of conditions. That is regarding the cellulitis. And then next, another infection in the hand which we can see is the deep spaces infection. The deep spaces of the hand is the thenar space, hypothenar, mid palmar, and digital web spaces. These are the deep spaces in the these are the compartments in the hand where infection can start, and as the spaces of communication to the forearm, the infection can communicate and pass to the before it gets visible to the patient. In all of the condition as it's an infection, antibiotics are only the treatment of the choice.
To avoid tenosynovitis, myositis, septic arthritis, all these things, initial antibiotics itself should be done. And if at all worsening, we'll have to plan on debridement. Okay.
Next, another thing is a phelon. Phelon is actually in the pulp of the finger, which we see. Throbbing, painful thing. It's usually seen in a diabetics when they because they use for multiple pricks for to check the GRBS monitoring in those patients. It's usually seen the phelon. Here, antibiotics is only the treatment of the choice. Next, paronychia. Paronychia is the infection of the nail fold of the skin. There are two types of paronychia, acute and chronic. Acute paronychia is mostly because of the bacteria, where it will be a red, swollen, and tender type of the nail. In chronic paronychia is seen in immunocompromised people, and it's mostly caused by fungus. Here the hands are wet. And the next condition is a herpetic which loss. This is a viral infection, and we can see this infection mainly in our healthcare workers who is exposed to the saliva of the herpes patients. These are like the small, like pupule type of conditions. Small, swollen, painful, blood-tinged blisters are present on the finger.
Okay.
These are the types of infections which you can expect in the emergency room. Next, the other thing which we did for this patient was a ring block. The basic principle of the ring block is that each digit is supplied by four nerves, two dorsal and two ventral nerves, and each nerve is every time associated with an artery. And so the basic principle in the distal, as it's having an end artery kind of system, here the local anesthesia is avoided to be mixed along with the adrenaline. And there are like this local anesthesia lidocaine which we use pH is acidic, highly acidic, as this is distal, and they may complain of pain when we inject it. Usually we can titrate it along with soda bicarb and neutralize it and give it. And also we should avoid giving in huge amount of it because of the space when it occupies, it will extend the finger and it will cause pain again. We should avoid giving huge volumes of that. If we require a higher dosage of it, it's better to go with higher kind of anesthetic agents.
So what is the dose of lignocaine we use?
2
to 5 mg
2 to 5
kg.
mg per kg. 2 to 5 mg per kg we can give. And it's given at the base of the finger at two junctions so that the whole finger gets anesthetized. Both the palmar and the dorsal nerves are insensitive to the pain.
Suppose this patient accidentally you are giving an intravenous injection. What will be the first complaint patient will be telling?
Pain severe.
Patient will be having paresthesia over the lips. Accidental IV. Okay.
After giving this ring block, we had safely maneuvered the nail out of it, and we closed with the sterile bandaging was done, and post which antibiotics as amoxicillin.
So did you give TT to this patient?
Yes, no, TT is also given.
Okay. So this patient, TT was also. When all will you give TT?
TT is given when there is this breach of the skin and any wound in you. TT.
Okay. What are the tetanus prone wounds? There are tetanus prone wounds. Okay. Prone wounds are there for tetanus. Which all are they? Any wound that is having some puncture wounds. This is a puncture wound. So some puncture wounds, especially puncture with this needle or any garden puncture wound, such puncture wounds. Then any wound with a foreign body inside. That is tetanus prone wound. Then any animal bite or scratch. Not human bite, animal bite or scratch. Then tetanus prone wound. Open fracture?
Open fracture.
Open fracture. Then anything that is causing any wounds that is leading to a sepsis. That is also tetanus prone. So these are the 5 tetanus prone wounds. And highly tetanus prone wounds are also there. Highly tetanus prone wounds. Which are they?
If there is
if there is devitalization of the tissues, like extensive muscle injuries or extensive muscle or tendon, if everything is so extensive injuries, then extensive devitalization and where the blood vessels, everything is involved. Then injuries that might require surgical debridement, and the conditions which present more surgical required treatment is required, and this if the surgery is delayed more than 6 hours, we will have to do it. Is highly tetanus prone wound. Okay. And if it is heavily contaminated, so in RTA cases and all, if it is involving some tar or any mud, soil, these conditions, it is highly tetanus prone wound. Okay, when all will you, so in these conditions we will have to consider what?
Giving
TT injections. Okay, then when will you give immunoglobulin?
Immunocompromised people.
Only immunocompromised will be giving immunoglobulin.
And even highly.
Immunoglobulin will be given in some tetanus prone wounds and highly tetanus prone wound. So if this patient is having a tetanus prone wound, so we are talking about immunoglobulin. Okay. So we need to discuss about the immunoglobulin. Okay. So immunoglobulin will be given in tetanus prone wound who doesn't know about the immunization status. Immunization status is not known. Okay. And if the person was never immunized with TT, immunization status means tetanus immunization according to the schedule I am talking. So immunization status is not known or never immunized, or if it is age more than 63 years. 63 years. Okay. And in highly in highly tetanus prone wound, immunoglobulin is considered when this patient was not vaccinated for 10 years. TT patient didn't receive any TT for 10 years, or if it is a child between the age of 5 to 10 years, if the child has received only the infant doses and didn't receive the 5th year and the 10th year TT boosters, then also you will have to consider giving immunoglobulins. This I am talking about the tetanus TT which patient has received previously. Then only we will be considered giving immunoglobulin. Okay. Okay. Then what else? Okay, so this patient, we have first, when this patient came like this, we took an X-ray, we gave analgesics, ring block was given, then we removed it, we gave TT was given, and then we have discharged with antibiotics.
Prophylactic antibiotics.
Okay, thank you.